Good evening, everyone. I see some familiar faces from last time. Today there are two talks actually. I'm going to talk on prevention. Um, World Cancer Day is on 4th of Feb, and since this talk actually got postponed from last 2 months, I thought we'll focus on cancer prevention. But the lifestyle changes that I'm going to talk about are applicable for all non-communicable diseases, which are mostly because of lifestyle related factors. So high blood pressure, diabetes, cancer, and I have another presentation, which is cardiopulmonary resuscitation, which is CPR, uh, what we do when somebody has a cardiac arrest. So we'll finish this and then I'll talk about that. So talking about cancer, we all know that it's generally an abnormal growth of cells. So they start growing abnormally and there is an uncontrolled growth. And that can affect any part of the body, right from your skin to the bones, blood. So everything, any part of the body can have cancer. And if we look at Indian statistics, 1 in 9 people are likely to develop cancer in their lifetime. And the incidence is increasing more and more mainly because of the lifestyle factors. Cancers of oral cavity and lungs are more common in men, and cervix and breast in females. And together, they account for about 50% of all cancer deaths in India. And if you take cervical cancer, almost all cervical cancers are because of a viral infection, HPV infection, and 90% can be prevented just by vaccination. So if you look at this, that is the scale of the disease. I mean, 50% is caused because of all these four cancers, and one of which can be actually completely prevented by vaccination. Many cancers are preventable by lifestyle changes, and regular screening, early detection, and early treatment can reduce the death rate. So these are some of the common cancers. So for women, it is breast, cervix. For men, it is oral cavity, lung, stomach, colorectal, and pharynx. And for women, it is colorectal, ovary, and lip. So what actually causes cancer? So there is genetic mutation. So the DNA structure which we have, there can be genetic mutation in that, and that can lead to abnormal growth of cells. Cellular inflammation is also very important. So inflammation essentially is a process in the body when there is an injury or infection. It is a process which helps to heal actually. So acute inflammation which occurs because after an infection or an injury is actually protective and is helpful for the body. But when we talk about chronic inflammation, sometimes this inflammation goes on for a very long time. So slow kind of a background chronic inflammation will result in all sorts of health problems. And that is now known to cause diabetes, even Alzheimer's. So that sort of a chronic low-grade inflammation is responsible for most non-communicable diseases. Lifestyle factors play a huge role. Other causes of cancer could be infections, pollution, chemical exposure. And obesity is known to cause almost 13 different types of cancer. So these are some of the risk factors. Now, if we look at the list, lifestyle factors, which if we include tobacco, alcohol, sedentary lifestyle, and obesity, they account for almost 65 to 70% of all cancers. And if you look at the family history of cancer, that's only 5%. So we usually think, oh, cancer, if somebody in the family has a cancer, that you're doomed, you will get a cancer. Or most of the time is cancer is because you had some family member who had cancer, but that is only 5%. That's only about 5%. So rest, almost 65-70% is because of unhealthy lifestyle choices. If we look at cancer and obesity, these are some of the cancers which can be caused by obesity. So having excess of fat and being overweight can cause all of these cancers. So what are some of the preventive measures we can take? Obviously, not to smoke, avoid alcohol, maintain a healthy weight, exercise regularly, eat a healthy diet, and protecting yourself from the sun, infections, and getting screening tests done regularly. And why does lifestyle matter? Because almost 30 to 50% of the cancers are preventable. And small lifestyle changes can make a big impact. And we all know that prevention is better than cure. So going back to when we used to think of food, focus on healthy food, and food as medicine is so important, because um, what we eat, we are what we eat, and whatever we eat has effects on our health, or at the cellular level, on health, skin, everything. No single food can protect, obviously, against cancer by itself, but including a nutrient-rich diet with a variety of fruits, vegetables, whole grains, nuts, and seeds, which then provide you with fiber, they provide with phytonutrients and antioxidants. So these are all the compounds that plants have, the colored plants have, which help in reducing the inflammation in the body. They boost your immunity, and they help with maintaining good health. The fiber, which is found in the fruits and vegetables, that helps maintain healthy gut microbiomes. It improves the insulin sensitivity and decreases the risk of some of the cancers, and mainly the gastrointestinal cancers like stomach, colon, and all of that. Non-starchy vegetables and fruits, rich in carotenoids, vitamin C. So these are some of the sort of micronutrients and nutrients compound which are found in the fruits and vegetables, and they decrease the risk of breast, lung, colon, and bladder cancers. So if you look at this chart, so we always say eat the rainbow, and if you look at this chart, each color has so many. These are just fruits. These are not even vegetables included in this. It's just fruits. So many fruits are available, which are, they're full. They have a lot of. So phytonutrients are the compounds which give them the color, and each colored fruit and vegetable has a different. They have different phytonutrients, and that has an effect on your health. So including a variety of fruits and vegetables is also very important. And if you count this is about 50 different fruits, just fruits. So including seasonal fruits, eating fresh, eating raw fruits. Obviously, at least, even if somebody has diabetes, they can definitely eat 2 fruits a day. Okay, and including a variety will give you different phytonutrients and help you fight cancers, fight infections, injuries, and all of that. So these are some of the sort of compounds that various fruits and vegetables have. Turmeric, again, is very, very important. It has anti-inflammatory and immunity boosting properties. Turmeric is now available in the Western countries in the form of capsules. We have turmeric in our kitchens, isn't it? We use it quite regularly. So again, going back to the Indian way of cooking, using all the herbs and the spices, and cooking simple food obviously helps. But we are moving on from eating home cooked food to eating all the processed food. We have Swiggy and Zomato at our doorstep. Everything is delivered to us. So we've moved from eating healthy to eating a lot of processed food and a lot of oily and not so healthy food. So what should we avoid? We should avoid meats. This stands for highly processed, ultra processed, high in fat, sugar, and salt. So essentially, bakery products, biscuits, your cakes, anything that comes in a packet is processed, chips, and all of that. So those foods are very high in saturated fat, which is not good. They're very high in salt and sugar, and they cause, again, inflammation, and they then lead to increase in weight gain, and then obesity leads to various other problems. Alcohol, again, no amount of alcohol is safe for health. Okay, and if you look at this diagram here, um, This is the International Council for Research in Cancer, and they have graded this into carcinogenic, means causing cancer. So processed meat is known to, if you consume processed meat over a long time on a regular basis, it is known to cause cancer. There is evidence that it will cause cancer. Grade 2 is probably cause cancer. So including the other types of meat, red meat, can lead to cancer. So coming to physical activity for, sort of preventive cancer, dealing with cancer, we think of physical activity in terms of, we think of exercise mainly as, if somebody wants to reduce weight, we'll say, oh, you need to go and exercise. But that's not the case. Everyone needs to do some form of structured physical activity to just maintain health. Okay, obviously it will, help you reduce weight and prevent obesity. Also has a feel good factor, and you have to include a combination of aerobic activity, which is, it can be dancing, swimming, jogging, running, and strength training, including lifting weights or working out in the gym, yoga, sports. So especially for women in the perimenopausal age, we have to do strength training, because that helps in, building up bones, and it protects you from osteoporosis and all the other problems that occur in perimenopause or menopausal age. To maintain a healthy weight, you need to exercise for about 150 minutes per week. So you can break it down, say 30 minutes a day for 5 days, or whichever way, you get time, whenever you get time, and whatever your work allows you to do. Moderate intensity means, your heart rate has to be faster, and you should be breathing fast when you do, not like strolling leisurely in the park. That actually doesn't count as a exercise. It doesn't really burn any calories. So your heart rate has to be a little faster, and your breathing has to be faster when you're doing these exercises. If you want to lose excess weight, then you have to at least exercise for 250 to 300 minutes per week. Sleep, again, is extremely important. The circadian rhythm is like the natural clock, a bodily clock which is there. And what it means is, if you're following a circadian rhythm of your body, then you rise with sunrise, and you tend to sort of wind down as sun sets. So you finish off having your dinner early before sunset, and you slowly wind down. But nowadays, that doesn't happen. I mean, it's very difficult for us to have that sort of a lifestyle, especially young kids, also people working in IT companies. Because of the way the work is structured, it's very difficult, and it's very common to find even children, for that matter, awake at 2 o'clock, 3 o'clock in the morning. So, that disturbs the biological clock that we have. We don't follow that, and that causes a lot of disturbances in our body. So healing and repair occurs when we sleep, and therefore it's important that we get adequate sound sleep in the night. Good sleep will reduce your stress levels. Some of the dietary things that you can do is avoid fatty, spicy, and sugary foods in the night. Restrict the use of coffee, usually about 6 hours before bedtime, because coffee, caffeine is stimulating, and it may not allow you to sleep. Foods that can improve sleep are bananas, almonds, walnuts, kiwi, oats, and chamomile tea. Some other fancy teas that you get, like jasmine tea or chamomile teas, are usually good for getting good sleep. Exercise, again, regularly. That will help you, fall asleep well, not just before bedtime, but during the day sometime. And meditation and things like yoga nidra will help you as well. Stress is a big issue in our day-to-day life. All of us are stressed at all times. Even the small children, they'll be like, I'm stressed. And that causes changes in the blood pressure. It lowers your immunity. Your gut function can decrease, and it can delay healing. Now, so stress in itself obviously is not like the single most factor to cause cancer. But if you include everything, all the bad lifestyle habits along with stress, can then increase the risk of having cancer. And obviously, if someone has cancer, that is going to cause them a lot of stress in life, and that may cause them to be depressed or anxious. And so then you fall into a kind of a vicious cycle where stress increases the risk or delays your healing, and then that then causes more stress. So it is important to have some stress management methods, or do some stress management techniques to um, to relax and to not go into the depression, anxiety kind of a cycle. And somebody who is stressed cannot, doesn't feel like then following healthy lifestyle habits, because they don't, there's somebody who's depressed might not feel like going to the gym or doing an exercise, and they may have, they may resort to emotional eating. So that adversely affects your health behaviors essentially. And then again, it's a cycle. So you're not following healthy lifestyle, maybe you're resorting to substance abuse, that causes more problems, that causes more stress. So you go into a vicious cycle again. From nutrition point of view, if you eat a whole food plant-based diet, the one that I explained, including lots of fruits and vegetables, nuts and seeds and whole grains, that will promote healthy gut microbiome and will positively influence brain function. So the serotonin, which is there, most of it is secreted in the, actually in the gut. Gut is like the brain, the stomach and the intestines and all of that is called as the gut. Physical activity will help release happier hormones, and again, sleep will reduce your stress levels. And again, you can do some mind body practices to reduce stress. Meditation is a very good, rajyoga meditation. I'm sure most of you have done rajyoga meditation here. So that is a very good technique to reduce stress. Mindfulness means focusing on what you're doing. So if you're eating, just focus on eating, not watching television. Whatever work you're doing, focus on that. That helps you reduce overall stress. Now, some of the early warning signs. So caution is the acronym for this. If you look at it, some of the warning signs for cancer. So if you have some changes in bowel or bladder habits like diarrhea, constipation, or if you have a sore or a cut which doesn't heal, if you get a cut, your body develops those, will have a process where it will heal, the cut will heal. But if it doesn't heal for a long time, if you have mouth ulcers which don't heal for a long time, or there's unusual bleeding or discharge from any part of the body, there is a swelling or a lump, like in the breast or underarms, if you have problems in digestion or difficulty in swallowing, or if there is any, again, mole is like the black thing that you get on your skin, and if it's growing in size, if it's changing color, or if you have a nagging cough or a hoarseness. So these are some of the early warning signs for some of the more common cancers that can happen. So if you have any of these, then you need to visit the doctor, you need to get tests done, because that may be an indication that you're either developing cancer, or it could be just a precursor to cancer. And then if you detect it early, you can have early treatment, and that has better chances of survival. Also, sometimes you have unexplained weight loss, and you feel fatigued, you feel tired without any reason, or there is aches and pains, bone pains and all of that. That could be an indication that there may be something wrong, and it's best to get medical advice at that point. Now, if you think about screening, regular health checkups will prevent and detect early cancer. Okay, because there are some screening tests which can be done. There are lots of laboratories now offer the packages, women's wellness package, men's wellness package, and they do cover a lot of tests in that, and some of them will be helpful in detecting cancer early. And the earlier you treat, the better it is. So these screenings are available for breast, cervical, prostate, GI cancers, and some other cancers. Now, some of the tests may be needed in high-risk people, and those who have high-risk factors may need to get it done more often, and also start it at an earlier age. And the high risk factors could be if they have a history of cancer themselves, or they have a family member who has cancer, and could be exposure to certain cancer causing agents like tobacco or some workplace chemicals, and older age group. Now, there are some Government of India initiatives through the National Health Mission, wherein persons over the age of 30 are screened for not just cancers, but for diabetes, hypertension, and other non-communicable diseases. And for cancers, they screen for oral cancer, breast and cervical cancer. So these are the most common ones, which are contributing to almost 50% of the deaths in cancer-related deaths in India. In oral cancer, again, if you have a ulcer which is non-healing and which has been there for a long time and it doesn't go away, or it's just self-examination itself can help. But with the government initiative, they have trained healthcare professionals, they have trained ASHA workers, they've trained some other nurses to detect these cancers. Again, cervical cancers, very important for women to get pap tests done. Pap smear is a very simple test which can be repeated every 3 years. After the age of 25, all women should get it done. And for younger women and girls, HPV vaccine is available, and which prevents almost 90% of the cervical cancers. So, that is very important. For breast cancer, again, clinical breast examination by trained healthcare workers. So prevention is power, and we know that small changes we do today will protect our tomorrow. So with that, I finish with this one, and I'll just go through the other presentation as well. So cardiopulmonary resuscitation, does everybody know what cardiopulmonary resuscitation is? So cardio means related to the heart, and pulmonary is related to the lung and the breathing. So we're going from prevention to something that we need to be aware of, or we need to be able to do when somebody has a cardiac arrest, or somebody is not responsive or having a cardiac arrest. So can anyone tell me the difference between cardiac arrest and heart attack? Have you heard of the term cardiac arrest? Is that a familiar term? So what is the difference between a heart attack? We hear heart attack all the time, isn't it? We don't hear cardiac arrest so much, but we hear heart attack. We say, oh, this one had a heart attack, that one had a heart attack. What is the difference between the two?
In cardiac arrest, I think person will die.
Okay.
And in heart attack, there is a symptom, just a kind of symptom, or sometimes he survives, sometimes he might not survive.
Yes. So yes, so heart attack can lead to cardiac arrest, but cardiac arrest has other causes as well. So in a heart attack, what essentially happens is that the blood flow to a particular part of the heart might stop, and sorry. Yes, there may be a clot in the blood supply to one of the parts of the heart, and that part of the heart might stop. Now, if it is a if the blood supply has been compromised a lot, then that the person can have a heart attack and then have a cardiac arrest. I'll explain what cardiac arrest is. It's when the heart stops working. So the difference in heart attack and cardiac arrest is when your heart has stopped working totally. So your heart is a pump. Yeah. So that pump has stopped working. That is cardiac arrest. In a heart attack, the heart may still be pumping. All of the heart may not pump because a part of the heart may be is died, so it's been injured, or could be part of the heart may be dead because the blood supply has been stopped to that part of the heart. So heart attacks, as you rightly said, sir, that from you can survive after a heart attack. People have minor heart attacks, or even if they have major heart attack, they get angio or whatever done, and they do survive. Especially with we have good in Hyderabad, especially we have good ambulance services, we have hospitals all around, so there is a possibility that a person will survive the heart attack. But with a cardiac arrest, your heart has stopped completely. And unless you do something immediately, there is no chance of survival, okay, because the heart pump has stopped. Okay, so that is the basic difference. So, so when you talk about cardiopulmonary resuscitation, what essentially you're doing is that you're trying to cause movement in the heart, like by giving the what we call as a CPR, you're trying to mimic the function of the heart by making the heart pump the blood by manually compressing the heart. Okay, so there are three steps to doing the CPR. First is, how do we know that somebody has had a cardiac arrest? Okay. So the simple way is, if somebody is unresponsive and not breathing, or they're breathing very erratically, they're not breathing, we're all breathing now, we're normally breathing quietly, or in a rhythmic fashion. But if somebody is not, the breathing is very erratic, or like a gasping kind of a breath, they're taking one breath once in a while and they're completely unresponsive, then you should assume that they have a cardiac arrest, they are in cardiac arrest. Okay. And it's very important, if you see somebody collapsing in front of you and then they become unresponsive, or if you find somebody unresponsive, it could be in your family, it could be in your home, outside mall, it could be anywhere, then you check whether they, you think they are in cardiac arrest, you call for help immediately, because just doing CPR is not going to save them. Doing CPR is just buying time. You're not saving them, but you're buying time. And effective CPR can double or triple the chances of survival after somebody has a heart attack. So it is extremely important. You could actually save someone's life. And then you do the CPR. So first, when you see somebody collapses in front of you and then they become unresponsive, they're probably they had a severe heart attack or any other reason for which they could have a cardiac arrest. And or if you see somebody lying there, then first you confirm by just shaking them or by tapping them, or if you know their name, you call out their name, you shake them, and you see whether they're responsive or not. If they're not responsive, then you check their pulse and breathing. So the best, as a non-medical person, the best thing to do is check the pulse on the neck, because that's like the big artery there. And if you this is your throat, and just next to the throat, if you put your hand, you can all feel your pulse. And check the pulse for about 10 seconds or so. And while you're checking the pulse, also see if they're breathing. So, normally you will see the chest rise. Yeah. And you can hear the sounds, maybe, sometimes they could be breathing very loudly. So you just check whether they have a pulse or they are breathing. Even if you're not able to kind of gauge whether they're breathing or they have a pulse or not, but if you think they're completely unresponsive, it is best to start CPR. So when you start the CPR, if they're alive, they'll probably wake up. But that should not delay doing CPR. Not knowing whether they have arrested or not should not delay the CPR. So once you've established, or once you think they are in a cardiac arrest, then you call. So in Hyderabad, the number, does anybody know what number to call for an ambulance? 10? 100? 100? 108? 108? I think it is 102. In Hyderabad, it is 102. In all India, I'm a bit confused as well. I've never had to call an ambulance, fortunately. But I think all over India, it is 112 is a general number for all sorts of emergencies. But in Hyderabad, I think it is 102. Okay. So you either call that, or we always have people around us, isn't it? In India, we find people all over, everywhere. So you shout for help. You just shout, and people will come to help. So this is also very important, because one person cannot do CPR for a very long time. It is a very difficult thing to do. It's very hard. So you call for help, and then you ask somebody to call the ambulance, or you call the ambulance, and then you do the CPR. So this is, I have a video, because that video explains quite well, but this is roughly where the position should be, and the hands should be completely straight. You should kneel on the side of the patient, and this should be the position. And so you do about 30 compressions. So again, now the CPR, as I explained, cardiopulmonary, so it involves the heart and the breathing. Okay, but now if it's your family member, you may be okay to do mouth to mouth respiration, but if you find somebody lying on the road, you may not want to do. Okay, and it's absolutely understandable. So it's okay to do only compression. So it's called calls, which is the compression only life support. So now, so the main sort of CPR involves giving 30 chest compressions and then giving 2 breaths, mouth to mouth breaths. But if you're not comfortable doing the mouth to mouth breathing, just continue with the CPR. So you just continue CPR till you get tired, and if there are other people around, then they can take over from you when you get tired. And you have to give them about 100 to 120 compressions per minute. Okay. So this is a video. It's on the YouTube as well, and it shows how to do. दबाओ सीना जोर से बार बार, 1 मिनट में सिर्फ 120 बार, देखो सीना ऊपर आए हर बार. Oh, what just happened? Sorry. मिलाओ दोनों हाथों की ये उंगलियों, बीच सीने के रखो हथेलियां, दबाओ सीना जोर से बार बार. So that's how much, that's 2 inches depth should be there. See, their hands are straight, and this is also an important part. The Sina Upparana, what they say is an important part. Now imagine your heart is like a bag or a balloon filled with water. There is water coming from one side, and then there is water going out from that balloon. Now if you squeeze the balloon, the water from the balloon will go out, and if you keep it squeezed, it's not going to fill up. So the blood has to come back into the heart. So you squeeze and you let go. You squeeze and you let go. So this is a very important point here, which is, you're compressing the heart. This is exactly what is happening inside. So you're pushing the heart. So that is, whatever blood is there in the heart is being squeezed out. It goes all over the blood. It supplies the oxygen to the rest. And then you release your you don't have to take off your hands. You just keep it there, press, and then come up a little bit, kind of. So the way they were doing it, so that will allow the blood to come back, refill the heart, and then सीधे रखना है, 2 इंच सीने को दबाना है, दोनों हाथ तुमको सीधे रखना है, जो थक जाओ तो दूजे को बुलाना है, इस शख्स को जमीन पर ही रखना है, रखना खुद पे और खुदा पे एतबार, एम्बुलेंस आने तक यार. So this is this tune. So this is a new tune by one of the doctors, and actually anesthesiology, the Indian Society of Anesthesiologists have almost, they've approved kind of this, because we know, all of us know these songs, right? So this is a very, very, very famous song. So the tune is, it's not that they've changed the lyrics obviously to suit the CPR, but the tune itself, if that gives you the rhythm for the CPR. So you do the thing with the tune, you will get the rhythm. So that is how much if you get into the rhythm, that will give you 100 to 120 compressions in a minute. So the other song which used to be used in, so the English song is Staying Alive. So staying alive, hey, 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 staying alive. So this is again, this is a good song to just, because you may not be able to count how much you're doing. If there are a lot, yeah. So you follow the rhythm of the song, and that will help you get the right number of compressions. Okay, so that was about that. So first check whether the person unresponsive is, you think, in cardiac arrest. Call for help like around, and somebody needs to call for the ambulance as well, because this is again just buying time. You just keep doing it, you're going to get tired, you're not going to get anywhere, because you're not actually treating it, you're just buying time. And then start with the CPR. You can only do compression CPR if you're not comfortable doing the mouth-to-mouth breathing, and continue, 30 if you're doing breathing 30 is to 2, or just continue 100 to 120 per minute roughly. And when you get tired, switch over, and that's sort of the um, the rhythm and the way to do it. Okay. So anybody has any questions?
So question, I have one question. In the slide you mentioned that to prevention for cancer,
Yes.
You need to need a sun protection.
Yes.
What does it mean
So
exactly?
that's a good question. This doesn't actually, because skin cancer is not very common in India, but these are the general guidelines for cancer prevention. And in some of the countries, skin cancer is on the top. Whereas in India, if you look at the first five, it doesn't feature in the first five or in the top causes of cancer. So essentially, sun protection means not being exposed to too much of sun, especially the afternoon sun. And the UV rays of the sun can cause skin cancer.
especially Europe.
Yes, they have the fairer skin have higher risk of getting burned, of having skin cancer. So maybe our genetic composition and the skin color protects us from skin cancer. So the prevalence of skin cancer in India is very low as such, given that there is so much of sun and so much of heat, and we are all in the sun. A lot of people are in the sun, whereas in Europe and all, where the winter, the weather is cold and they don't step out that much, and yet the risk in some of those countries are quite high. So you protect, they wear sunscreen, you wear goggles, you wear a hat when you go out, take an umbrella. That's sun protection basically.
So my point is that most of the people in Hyderabad, they are doing, working in IT shift, or they are working in the foreign banks.
Yes.
They support US times and the London time. So usually they don't get the sun. So like me, I woke up at 10 or 11 and then go for walk. So that's why I asked that question.
Yeah, no, 10 o'clock in the morning you wake up.
Yes.
Okay, so 10 to 11 is actually a very good time to get sunlight. So in fact, that's the best time to get some sun. And again, why would you need sun to get, the body will make vitamin D if you get exposed to sun. So you just need about 5 to 10 minutes of sun exposure, um, about 3 or 5 days a week. That's all you need. To 5 to 10 minutes, 3 to 5 days a week, 5 days a week, but of sun exposed on the skin, like not through clothes or not through windows or glasses. So direct exposure, and that will make, help your body make vitamin D. So that is all you need. Obviously, not sun exposure, but exposure to the light is good, because it prevents depression, or helps with, it sort of is a little preventive, because it sort of sets the circadian rhythm and helps with depression and all of that. You feel better when there is light, isn't it, rather than a dingy atmosphere. But that's all you need. So if you get up at 10 o'clock, you go for a walk, that's fine.
Okay, then thank you. One more question from my side. There was one symptom of cancer. So mole you mentioned, and
Yes.
nowadays everyone have some moles in their body. So uh, I mean,
I think
it
you're talking
grows
about skin tags.
not as skin. You can see this one.
Uh-huh.
So it was earlier a very small. Now it become a bit large
Mm.
as compared to in 6 months, 7 months. So yes. So how can it can be give you the symptoms of the cancer?
So again, that's the thing. If you think it's increasing in size, if it's changing color, or it's becoming inflamed, best is to see a skin specialist. most of the times the moles are sort of harmless, but if they're increasing or there are multiple moles in, on multiple areas of the body, or they're increasing in size, it's best to go to a skin specialist. They may, they will be able to guide you.
One second question. How early the cancer can be detected? Like 1 year, 2 years, how early?
So it depends on what cancer you're talking about. Like if you're doing
General.
screening, for example, certain cancers, when you do regular screening, it could be just the start of something. Okay, and like for example, for colorectal cancer, you do a colonoscopy, which should be done at sort of regular. I think it's 10 years. It's not that regular, but you could pick up something, like a small growth, which could possibly become cancerous later. But if you're catching it then you can make lifestyle changes at that point. It's just like blood sugar, for example. Your blood sugar is in the pre-diabetic range. You can make lifestyle changes and avoid becoming a diabetic. So it's that sort of a thing. So it depends. So that's why regular screening is very important. So you know some of the things you will obviously pick up. Some cancers can have very fast growth. And even though you screen, they may, but most of it, there is enough time to pick it up and do something about it.
Because some people, by the time they test, they see it has already come to third stage.
Yes, that's because so that's the other thing as well. One thing I find very common is denial, and just ignoring, if you start gaining weight, for example, you know you're gaining weight, like you're looking in the, you can see it in the mirror, but some people don't do anything about it. And some people think, no, it's fine, it's just something, so a lot of people stay in denial. They don't want to accept that maybe something is wrong. They don't want to go to the doctor just in case the doctor says, oh, this is a problem. Patients come and they say, problem to nahi na doctor sahab. You've come to the doctor, aapko problem hai. इसलिए आप आए हो. So just accepting कि है, but कुछ कर सकते हैं उसके बारे में. But if you stay in a denial mode and you say like मेरे को तो कुछ होने वाला नहीं, ये तो ठीक है, ये तो ऐसे ही होगा, kind of thing, then that causes the delay, and then you suddenly find out when you're not too well, you go to the doctor and you find out that the disease has progressed and you're in the last stage or whatever.
And one question I want. See, nowadays for the cancer they say only chemo is the one.
Sorry?
In chemotherapy and all they give it. But I understand sometimes even this Ayurveda, they have some treatment. Any idea you can, is it curable or is only a...
No. So there are a lot of cancers which can be treated. There are a lot of treatment modalities now. Other than chemotherapy, there is radiotherapy, there is surgery, there are immunomodulatory drugs, what we call as immunomodulatory drugs, which are not as bad as the chemotherapy. There are lots of other newer modalities for management of cancer. Now, I won't talk so much about Ayurveda because I'm an allopathic doctor, but I will say that again, like I said, food is very, very important. So turmeric, for example, just including, it's not going to treat your cancer, but including this helps get your body into a better shape, make you healthier, improve your immune system. There are certain cancer drugs which are formed, which are made from the plants. Okay, the one crystal, one of them, those pink flowers that we get, one of the cancer drugs is actually formed from the derivatives of that flower. So there is power in plants and herbs and all of this. Whatever, the only thing is don't go to quacks and get all sorts of weird treatments. But there are lots of treatment modalities other than chemotherapy available now.
But some people say you should not take too much of turmeric, then you look for alternative like lemon and all that. That's another theory.
Yeah, you can't. See, actually, the curcumin, which is the active compound in the turmeric, we can't consume that much to actually get, and that's why people are taking tablets now. But if you've been taking so you can't. the way to look at it is you can't, if you have something, a disease or a cancer, and I'm going to eat a lot of turmeric, it's not going to work like that. What I'm saying is, in our Indian food, we have been using turmeric for
Like a
a very
normal
long time.
consumption.
And it's nice to include it in wherever you can include it.
That's okay.
So that's the way to look at it, and everything together. So no particular food will be 100% protective, or you can guarantee that you will not have any problems or anything like that. But combined, when you eat all this fruits and vegetables, different colored vegetables and fruits, when you include spices, you include turmeric and all of that, garlic, onion, they all are very good. They all have different properties, and together they are protective. And together they can help, even if you have cancer, they can help you heal better.
And one more last question. You say biscuits and cakes and all that to be avoided, but it's very difficult to
Very
stop
difficult.
totally.
Absolutely.
Maybe one occasional.
Occasionally you can have it, on occasions you can have it, but it is difficult nowadays, especially when we are just surrounded by food everywhere.
Just like regular health checkups, we have CBC and other checkups.
Yes.
Can give initial hints about this cancer, or there are some specific tests that we need to go through?
For most of the cancer, there are specific tests. But say, for example, some blood cancers and all, that will reflect in your normal blood tests. Again, regular screening is important, because we should not look at cancer on its own. Everything is kind of interlinked. You have high blood sugars, your cholesterols are high, your triglycerides are high. That is kind of, all those things then lead to inflammation, and they can cause. So if your blood tests are sort of abnormal, you really need to take some measures, change your lifestyle so that you have normal blood tests. So that will not necessarily not give you cancer, but it will be protective. So, but for specific cancers, like for example prostate cancer, you have to do a specific PSAs, the antigen which you have to do. So normal blood test will not detect that. So depending on the age and depending on what cancer you want to test for, say you have a family history of something you want to test, then you will have to do a specific test for that.
Like for example, at any point, we or like our parents, we never know what sort of cancer they may develop. So by regular checkup, we won't be able to understand. Then what should be some concrete screening?
So the screening. So that's the most countries have screening guidelines for cancer. In India, we only have for oral cancer, breast and cervical cancer, and that's been started, sort of recently. And that too, I think it's done on the Ayushman Bharat, those schemes, and like I mentioned, those tests are being done. If you say you have, say somebody has a family history of breast cancer, some close relative had breast cancer, then they might want to go visit the breast surgeon and or even their physician for that matter, and say, this is the thing I'm worried about, what can be done. So in that case, then you can suggest mammography or other tests which can be done. So if you do not, so again there are two things, right? So there are the people who do not have any risk factors, who are fairly healthy, who are not very old, and then there are others who are sort of maybe elderly, who have other risk factors in it, and they could have risk factors for cancer as well. So in them, the screening has to be done at an early age. If somebody has a risk for breast cancer, say, they should start screening earlier than somebody who doesn't have a family history of breast cancer. And then in those cases, they may have to do it more often. Like, for normal people, if it is once in 2 years, for somebody with a risk, it may have been, it could be yearly. So that is the thing. So if you're specifically worried about, best to visit the doctor, and then they can tell you specific, because there's no one test to say, oh, you do this test and it will, you know whether you'll get a cancer or not. But for specific cancers, you can get specific tests done.
I understand from somebody, there's a test, I think, costs something like 10 to 15,000. You see the whole body will be checked up. I don't know whether it's true.
Something this new thing which came in newspaper as well. So there's a hospital in Hyderabad, they are scanning
Mm.
that which, the whole body
Yes.
is scanning, and
Yes, yes,
ISLM or something is
yes, yes. So again, you can get those things, and there's other one of the blood tests which is called as a CRP. It's also a marker of inflammation, but that will not necessarily give you. It's just that there's some sort of inflammation going on in your body with the CRP test, not what she's mentioning. Yes, there are newer things which are coming up, but then we don't have that much of evidence to support whether that is right or wrong. Most of the things could be just marketing as well. Yes, yes.
Which were the body is accepting is also not good.
Yes, yes. So there are a lot of things coming where they're doing it as a package, whether they're screening you fully or they're doing certain blood tests, and then they give you a overall risk, sort of what risk you will have of developing cancer. That is also there. There is actually, I forgot to put it in this. There are various risk assessment tools online where you put your age, you put whether you have diabetes, this and that, you have family history, and then that will give you a rough risk assessment. It will give you a you have so much percentage of developing a cancer in your lifetime, or that sort of thing. So there are some risk assessment tools available.
All these tests only done through blood only?
No, so some of it will be screening as well, like scan. For lung cancer, it could be a CT scan of the lung. For breast cancer, it is mammography. For cervical cancer, it's a pap smear. Some will have blood tests, like for prostate cancer. So GI cancers will need a colonoscopy. So it's a whole, the different things will need different sort of.
Advertisement here or somewhere, they said you check for cancer, they said it's having 3,000. But when you simply do the blood test, they said, oh,
Yeah,
it was couple of
There is a
Maybe
test
there
called
may be some
PCOS.
terms and
Yeah.
conditions.
PCOS even in the scan.
yes.
They just do the blood, they said cancer,
So yeah.
and they said 3,000 rupees.
Yeah. So PET CT scan can show, so the uptake will be there. It will be highlighted, depending on it will show on the scan if there is higher uptake of this thing that they give, and that may then indicate that there is cancer, or if there is cancer in the body, if that cancer has spread to those organs of the body. So that can be seen in a PET CT scan. Okay. So all of you will feel fairly confident to do CPR. Yeah, at least you will try. Yeah, try at least. So that is the thing, because as non-medicals, probably it's a little scary, but you have to try. Okay, thank you.
Thank you.